There is nothing more unequal than the equal treatment of unequals. This is a quote I came across by an unknown author today that I think is particularly relevant, especially in our society today that is constantly pushing for equality in all spheres. But I ask you, is equality something that we want in all spheres? I would argue that it's not, particularly in the healthcare sphere. And I think that there's robust evidence supporting me there, because if you look at the current state of health in the United States, CDC data shows that less than 7% of adults in the United States meet their criteria for optimal metabolic health. And why is that? Well, because we have a healthcare system that treats unequals equally. Namely, we are all unequal in terms of our physiology, our biology, and our health. And so our healthcare system, despite that, treats us all as equals. How? Well, its whole goal is to diagnose you, to give you a label. Once you have that label, you're no longer John or Jane or Sally. You are just that diagnosis. And that diagnosis makes you an equal with everyone else with that diagnosis. But conventional medicine is terrible with chronic disease, and chronic disease is what's destroying America. And the equal treatment of every unequal person or every individual with that diagnosis is what leads to their failure and their poor outcomes and the terrible health of the United States. So at least in healthcare, don't seek to be equal. Don't seek to be treated as an equal. Seek to be treated as an unequal or as an individual, because you are an individual that requires individualized and specific care if your hope is to heal from the diagnosis that conventional medicine has given you. So let's treat you as an unequal. Let's move forward and look for the individualized reasons that you are suffering from whatever your condition is, and don't seek to be treated equally. Seek to be treated uniquely, like the unequal, unique puzzle of physiology that you are. And by doing that, you have the best shot at reaching a life at optimal.